Welcome to this explainer. Today, we're unpacking a really fascinating platform called HealthcareWithAI Cloud, or just HWAI for short. If you've ever spent time in a typical modern Indian healthcare facility, you know the exact scene we're talking about. It's usually a whirlwind of administrative chaos. We're talking overwhelmed front desk staff, phones ringing off the hook, scattered paper records everywhere, and doctors who are stretched incredibly thin, trying to manage both patient care and clinic operations all at the exact same time. So today we're going to look at an operating system designed to fix exactly that by streamlining the entire end-to-end patient journey.
There's a quote that perfectly hits the nail on the head regarding the core problem we're addressing today. It goes, "A solo doctor doesn't have an office manager, doesn't have a marketing team, doesn't have IT support. HWA replaces all three." And honestly, that is so true. A busy solo doctor or small clinic owner simply doesn't have the budget or the bandwidth for dedicated marketing teams or IT support staff. They're basically trying to be the clinician, the manager, and the receptionist all at once, which creates massive bottlenecks. This platform is designed specifically to replace all those disjointed roles with one intelligent, automated system.
Okay, let's dive into this. Just think about the old, painful way of running a clinic. You might have one software for appointments, a physical paper pad for writing prescriptions, some completely separate billing tool, and a totally unmanaged WhatsApp business account. It's just fragmented, and things inevitably fall through the cracks. Now contrast that with the HWA way. This is a single, unified AI platform. Think of it as an invisible assistant that literally handles all the boring, repetitive operational work so the doctor can focus 100% on what they actually do best, which is patient care.
Here is our roadmap for today. We're going to follow the complete patient life cycle, starting with the booking and acquisition autopilot, moving into the smart clinic experience, covering seamless prescriptions and billing, looking at continuous care and monitoring, and finally, summarizing the complete ecosystem and its benefits.
Let's kick things off right at the very beginning of the patient journey. Section 1, Booking and Acquisition Autopilot. Imagine having a marketer and a receptionist working 24/7 without ever taking a break. The AI connects everything, your WhatsApp, direct calls, Facebook, Instagram, Google Business, and website chat into one unified inbox. So let's say a patient comments on an Instagram post at 11 p.m. No problem. The AI automatically responds in the clinic's unique persona, whether that's in Hindi, English, or Hinglish, and transitions that interaction directly into capturing a lead. Patients can even book directly right from a Google search listing. And the absolute best part, the AI actually remembers the conversation across all these different channels without a human ever needing to step in. Once the patient wants to book, this fully automated flow just takes over. The AI checks the doctor's schedule, offers available slots, and automatically issues queue tokens. And if it's a telemedicine visit, it's just as seamless. The AI books the online consult, but here's the kicker. It collects the consultation fee before generating and sending the Google Meet link. It's what we can call the invisible hand at work. The clinic gets a paid, booked appointment right on their calendar, and the front desk staff literally did nothing to make it happen.
So, the patient is booked. Now let's move the narrative right into the clinic itself with Section 2, the Smart Clinic Experience.
This is where we see a really brilliant dual-agent system. It works on two fronts. Out in the waiting room, you have the AI receptionist. An anxious patient can just scan a QR code on a smart screen and chat with the AI to ask about fees, timings, or services. Then, on the other side, working behind the scenes in the consultation room, you have the AI doctor assistant. This is managing the doctor's schedules, providing emergency alerts, and making sure the busy doctor knows exactly who is up next. And speaking of knowing who is up next, let's talk about smart queue management. When a doctor finishes a consultation and saves the prescription, the system automatically marks that patient's token as complete. The magic here is that the very next patient in the waiting room instantly gets a WhatsApp notification saying it's their turn, and the waiting room display updates automatically. It moves patients through the clinic like absolute clockwork. Meanwhile, everything is automatically syncing with the doctor's Google Calendar and tasks, so there are zero scheduling conflicts. Now, we've talked a lot about clinics, but HWA scales beautifully to fully digital hospital operations too. For larger facilities, the system includes a real-time bed management tracking available, occupied ICU and ward beds instantly. Furthermore, when a doctor issues instructions, those are instantly converted into tracked nursing tasks. Nurses can log the administration time and completion status right there in the system, smoothly coordinating complex inpatient ward logistics without a single piece of paper. The consultation is over, so what happens next? Let's move to Section 3, Seamless Prescriptions and Billing. Now, what's really interesting about this slide is just how fast this all happens. Literally, the second the doctor hits approve on their dashboard, the digital prescription is immediately delivered straight to the patient's phone as a PDF via WhatsApp and email. At the exact same time, automated bills and invoices are generated and sent digitally, but it goes even further. Through pharmacy automation, the patient can order those prescribed medicines right there on WhatsApp, pay online, and just grab them at the counter. Even laboratory integration is handled. Test ordering and digital report delivery all happen directly inside this exact same system. No waiting around for papers to be printed.
The patient has left the clinic, but the care journey absolutely doesn't stop there. Let's shift to Section 4, Continuous Care and Monitoring.
This is where the AI actively works to keep patients healthy and retained after they go home. In this continuous care loop, the AI actually sends medication reminders on WhatsApp and asks the patient if they've taken their pills. If a patient is confused about dosage timings at home, they can just ask the AI and it will safely repeat the doctor's exact instructions without modifying the treatment. Patients can even text in their daily blood pressure or sugar readings or upload PDF reports via WhatsApp, and it all automatically attaches to their medical profile on the doctor's dashboard. Finally, after the treatment period, the AI automatically checks on their recovery and can book a follow-up if needed. This level of massive automation ensures incredibly high compliance and just a phenomenal patient experience.
We've seen all the individual pieces. Now, let's bring the whole narrative together to summarize this unified platform in Section 5, Complete Ecosystem and Benefits.
Let's move to and see how this builds. Let's map out the complete patient journey automation from end to end. From that very first lead captured on social media to the appointment and queue management, right through the actual consultation with the doctor's calendar tools, down to the digital prescriptions and billing, and finally wrapping up with follow-up and retention. It's one unbroken, perfectly seamless digital chain.
So, what does this actually mean for the business of healthcare? Let's rapid fire through these benefits. First, you're providing 24/7 patient support without having to hire a night shift. Because you're engaging across social media and Google instantly, patient acquisition increases. Your front desk workload is drastically reduced because the AI is handling all those routine questions and bookings. Your operations are completely automated. The patient experiences zero friction. And because of those intelligent reminders, medication compliance is so much higher. Finishing up our list of key business benefits. Improved follow-ups happen simply because the AI never forgets to check in. Doctor productivity is massively enhanced because they aren't bogged down fighting with administrative software glitches. Crucially, revenue leakage is reduced, especially in telemedicine, because fees are collected before the link is ever generated. All of this leads to far stronger patient retention. And, as we saw with the bed management tools, this fully scales up to completely digital hospital operations. Bottom line, the busy doctor fundamentally regains their time.
We've covered a whole lot of ground today, seeing exactly how fragmented, stressful clinics can be completely transformed into seamless AI-powered environments. So I'll leave you with this provocative thought. Are you ready to let AI handle the operations so you can finally return to just practicing medicine? Think about the time and energy that could be saved. Thank you for joining me for this explainer, and I really hope it gave you a clear picture of what the future of clinic operations looks like. Catch you next time.